lower, okay? And she does a technique where she backfilled it to fill the, I've never seen it done like that. So we're gonna prime the piggyback itself, okay? So just like they did in the video, you wanna make sure that all of your rollers are clamped. So for this one, I would recommend if it's high up on the tubing, I would bring it down a little bit, clamp it off, okay? Alright, so we have our equipment. So based on what the drug guide says, or the insert or the bottle, that's what's going to make you determine what solution it has to go into and the volume of that solution. So for our purposes, we're going to say 100 mLs of the 5% dextrose, okay, for our medication. So we're going to select our medication here. So our order says we're going to be giving 1 gram IV piggyback, okay? And our medication is 1 gram per ml. So how many mLs are we going to be pulling up out of it?
1 ml.
How many? 1, okay? So we could use our smaller syringe here. So the dosage we know is going to be 1 gram, okay? So we've calculated our dosage essentially. Our dose is 1 gram, and we know that 1 gram is 1 ml, so that's how we get our 1 ml. Is everybody clear on that? It's pretty straightforward in this example, okay? So we've calculated our dosage. We have 1 gram. We're going to prepare our syringe and needle maintaining sterility, okay? Now there are going to be different types of needles, so just you know, be careful with the needle that you choose. Some of the needles will have a safety guard on them. These don't. So as soon as you're done with this, it's got to go right in a sharp container. Okay, so we maintained our sterility, okay? Right out of the package, the needle goes onto the syringe. So we're going to check our label 2 times against the Med-X before withdrawing the medication from the bottle, okay? So we're just going to re-verify. Patient's name, you know, it matches the medication administration record, matches the physician's order. Okay, and we're going to confirm again, the order is for 1 gram IV piggyback of Capsule. In our hands we have 1 gram per ml, so we're going to be drawing off 1 ml. We also want to make sure our expiration date is good. This is 12/2015, so the medication is good. And we're going to do that twice. So we did it once, we'll re-verify. Our order is for 1 gram IV piggyback. We have 1 gram per ml here. Okay, so we've done all of our checks. Now, if this is a multi-use vial, we're going to clean the top. Okay, we're going to be taking out 1 ml, so we'll pull the plunger back to 1 ml, and that's the amount of air we're going to put into the vial. Okay, we're going to carefully inject it into the vial, just like they did on the video. We're going to inject our air, and we're going to bring this up to eye level so we can see appropriately what we're doing. And then we want to bring it down to 1 ml, okay? And then again, we just want to make sure we have no air in there. Then before we inject this into the bag, you have to make sure you're doing another check, okay? So again, we're verifying. We have an order for 1 gram cefazolin, 1 gram per ml. We have 1 ml in our hand, okay? And 1 ml is going to go in the bag. And just like with the video, just be careful when you're putting it through because the needle can go through the bag and stick it. So right into the area there, and then we're going to inject it, okay? Now we're going to get rid of our syringe with the needle. And we want to label immediately, okay? So on the label, you're going to have the patient's name, the room number, the date and the time it was prepared. By is going to be your name. the flow rate we're gonna get to. Expiration for this, we're not gonna do the expiration because we're giving this drug immediately. You know, different medications will have different expirations, so it would really be site-specific to the setting that you're working in. And then we want to label the medication and the dose in the bag here, okay? So we'll put our label on. And then we just want to gently mix our medication. Okay, so this bag is labeled now, okay? So essentially we did step 10, we injected into our solution, we labeled, okay? And we also want to label our tubing. So again, we're going to verify, now we're going to go to the patient's bedside, okay? So we're going to verify the MedX with the physician's order and identify our patient using 2 patient identifiers. Alright, so we did that check. We're going to assess our IV site before we start any infusions. And then we're going to hang our secondary set, okay? So we already set this lower. And we clamped off, okay? So this port here, the blue piece that we're going to be pulling out, is sterile. Let me just make sure it hasn't been punctured. Okay. Alright, so you would take the blue piece out, you would take the cap off of our plunger here, and it would go right in, okay? Now, in order to prime this, like we mentioned, in the video, she kind of did it backwards and primed it before she plunged it into the bag. That's not what we're going to do here. So we put it into our bag. We're going to squeeze this and let this chamber fill up, okay? We're halfway, 3/4 of the way. And then we'll slowly open this clamp to prime it down to our the end of our tubing here. And you just want to be careful. You don't want it to go too fast because we don't want to lose any medication, but we also want to make sure we get all the air out of it. So you just follow it down. Okay. And then, just like in the video, we're going to select the highest port on the primary line. Before connecting this, though, we have to make sure we wipe this with alcohol. So we'll clean this site. Our secondary tubing has this cap on here, so it's already clean. But you just want to be mindful that you're not, laying it on the bed, letting it hit the ground or anything like that. Okay. And then both sides are clean. We're going to attach, and then everything is clamped off for right now. We're going to open the piggyback line, the secondary line, all the way up, okay? So now this is going to be controlled by our roller clamp on the primary line, okay? And it's gravity that's letting us do that. Because this bag is lower, this bag is going to be controlled by this, and the port is high up here, so we have that control. And then we would just have to calculate out our drops per minute, our flow rate, and then set that accordingly using this roller clamp. So in this, for our purposes here, we're literally going to have to count them out. Depending on the setting that you're in, if you're using a pump, the pump will make that calculation for you. But here we have to calculate the drops. Okay. So we hung our infusion, we calculated our rate, and that's information that we would get from our, assistance from the drug book. We opened our secondary infusion there, and then we controlled by the primary line. Okay, then we want to correctly record the medication administration in the MedX, or the medication administration record, which is provided to you, or will be provided to you. After the medication is done, we just want to make sure we would come back and readjust the primary if we needed to. If there was maintenance fluid or something like that running, we'll dispose of all of our equipment appropriately. And then again, we want to monitor the patient for the therapeutic effect of the medication. So if we gave a medication for nausea, we want to see if that was alleviated. If we gave a pain medication, we want to reassess that pain. And then we want to document the amount of fluids we gave in the patient's intake and output. All right, are there any questions with that? Okay. Before we practice that, there were math problems, in the book. Okay, page 46. Before we go ahead, we'll just do these practice problems here. So you guys want to take a 15-minute break?